Good morning, everybody. Welcome back to the channel. My name is Kelly Troutman. I am a certified hand therapist. In today's video, I'm going to show you how to do a few simple exercises to help strengthen grip using Therapy Putty. So that's what we're doing today. I am using a lower level of putty. You can use whatever level is appropriate for you. Definitely if you are looking to strengthen your grip, your intrinsic muscles, this is a really great tool. Let's get into it. One of the Theraputty exercises that I like to give, or exercise routines, I should say, for my patients is actually using the 4 intrinsic tendon gliding positions and just using the Theraputty in those movements. So of course you've got your hook fist, your full fist, the flat fist, and then the lumbrical grip or the tabletop grip. So those 4 exercises are really good for strengthening all of the little intrinsic muscles in the hand. It helps with all of the extrinsic flexor muscles as well that are controlling the fingers. So it helps FDP, FDS, all those lovely muscles. So to do those exercises, you'll have your putty out. The hook position is one of the most, not difficult, but just tricky to understand how the movement works. So make sure that your patient knows how to do a good hook fist, that they're not anywhere in this range, right? They want to keep those MPs completely straight and they're only bending in the IP joints. So there's a couple different ways you can teach them how to do this. They can start with kind of a log of putty, block the MP joints, and then from there, squeeze the IPs in like a claw. Make sure that they don't get into this movement, right? They've got to keep it up here. So you can see my MP joints are straight, like that. They can also do it resting down on a tabletop. Sometimes that's easier for people to understand, so they can rest their hand flat and then dig it in on the table. So you can do that a couple different ways. Figure out what works best for your patient. I usually recommend doing that exercise about 8 to 10 reps and about 2 to 3 sets in an exercise session. The next exercise will be the full fist. Obviously with this one, you're just gripping those fingers in as much as you can, all 3 joints bending. And then for a little extra coordination, you can have them rotate it with their thumb. Harder than it looks for sure. And squeezing and then rotating. Again, completing about 10 repetitions, 2 to 3 sets, 8 to 10 repetitions. The flat fists, I always have them practice doing this a few times first, just so that they can remember the movement or the motor pattern, because people are going to want to get those DAP joints bending. So again, with this one, you can kind of stabilize the putty with the other hand, and then again, flat fist, keeping those DIP joints completely straight as you squeeze the putty in. And my pinky doesn't want to cooperate. They can also do these exercises in supination too, if that's easier for them or if that feels more comfortable for them. So that's the flat fist. And then last but not least, the tabletop or the lumbrical grip. With this one, again, make sure they're not bending all those IP joints. They need to stay completely flat here. I like to make the putty a little bit thin for this rather than having like a big blob. So have them kind of spread it out a little bit first. And then from there, they can do the lumbrical grip, just squeezing down with the thumb. Like that. So that's the 4 intrinsic tendon gliding Theraputty exercises. Have your patients do these. It will help build them strength. I use them a lot in the clinic. I give them to people for at home. They can also do that with like a stress ball at home if they don't want to purchase Theraputty or something, if their insurance won't cover it. I hope you guys enjoyed this video showing you 4 intrinsic muscle strengthening exercises with Theraputty. Stay tuned for the next video. Thank you guys for watching.